Dr. April Spencer, a leading breast surgeon, host of Urban MD, airing on Service Fox Soul, and joining us now to talk about this. She's been on here before, and good to see you again.
Good to have me back.
So I want folks to you remind our viewers about your history and how you got into focusing on what you do now, taking care of women, their breast cancer, because it's not just about breast cancer, is it?
It's not. It's really about not just your breast health, but your best health. And in my surgery training, I just had this affinity towards making sure that we are doing what we have to do for the ladies to keep everyone healthy. And one of the things that's been so alarming recently is that, you know, we've made a lot of great strides in breast cancer. The mortality rate is down 44%. And screening rates are up, but the thing is, we see an increase in breast cancers in young people, in patients that are like in their 20s, 30s, 40s, and especially within the last decade, like 1.4% increase. So breast cancer is steadily climbing, but so especially in the young women.
We did a story on that yesterday, and the positive, as you said, was that more women are living with it, battling it, getting through it. But do we know why more people are being diagnosed with it?
A lot of it is, well, twofold. One, our screening rates have increased, so we have the ability to catch things a lot sooner than we did in the past. So maybe people who weren't
being screened before.
Sure, but also lifestyle changes. So we have more sedentary lifestyle. There's been an increasing rate in obesity, a lot of people working from home, and there's a lot of stress and lack of rest. And so these things, and the environmental factors, so those are the things we have to consider.
You know, I haven't thought about that in a while, but people love the idea. They learned after COVID they could work from home. So people liked and they wanted to continue that. Some have even fought against going back into their offices. But that can lead to other problems if you stay at home all the time, right?
It can, for sure, especially just that sedentary lifestyle, sometimes poor culinary choices because we have access to food that can be readily delivered. Oftentimes we're just too exhausted to go to the gym. But I tell people, you know, you just have to be proactive. I always talk about the ABCs. So have awareness of your anatomy. If you see something, say something. And also be aware of the screening guidelines. You still need to get screened starting at age 40. And if you have a family history, you need to be getting screened sooner. And so a lot of our young people are not at screening age, so it's important to talk to your doctor about your family history. The B is behavior. So again, just quit smoking, make sure that you're exercising, eating well, stressing less, getting rest. And then lastly is C, is consumer choices and culinary choices. So in terms of consumer choices, a lot of people are not mindful of what they're putting on their bodies and in their bodies, so make sure you're reading the labels, and especially like supplementation, because people just don't want being healthy to be a hassle. And so about 85% of women are on supplements just to be healthier. But did you know some supplements can interfere with current treatments and your current medications to make them less effective?
And you're talking about over-the-counter supplements that people may not have maybe researched very much.
Yes.
I would assume.
Yeah.
Okay.
For sure.
You have a new supplement, though, that you said that you've done. Tell us about this one.
Oh my gosh, I'm so proud of it. It's like 20 years of research backed by science with the most robust information that's out there. And it is really, really extremely helpful for women in terms of reducing overall body fat, reducing the inflammation in the breast and the body, but also helping to boost the immune system while strengthening our hair, nails, and skin. All the things that ladies need, but in one supplement. So, and you can also put it in your smoothies and your teas, so it's a capsule, so it's very, very easy.
All right, and what's it called? If anybody wanted to, now she's not here to sell it, she was just telling me about it, so we wanted to tell you, So where can people find it?
Yeah, it's just breast, and you can just find it on my website at drapraprilspencer.com.
All right, Dr. April Spencer, anything else you want to say real quickly before we go that maybe remind women to make sure they get those exams?
Yes, definitely. Just remember that early detection means better protection, and so make sure you get your screening mammograms, not just in the month of October, but we need to be aware of this year-round.
All right, she is Dr. April Spencer. So great to see you again.
Oh, very, very nice to have.
Okay, good to see you too.
Thank you.
All right, still ahead this morning, we're going to take a break. We'll be back with JJ.